we will use three products here. It will be a combination protocol. So actually, for the eye area, of course, it is good to use MesoWharton here, because we have the manifestation, the clinical signs of the corona aging. We have skin laxity, skin atonia, we have wrinkles. So, of course, this is the clinical indications for the MesoWharton. But we also have some puffiness in the orbital zone. And I need to show you how to inject. So that's why, yes, I chose three products. But in a real life, it is impossible to make in one session MesoWharton or mesoxanthin with MesoEye, because it's the same area. So you always have to choose. But MesoWharton, this is the collagen formation stimulator. So this is the corona agent. Of course, periorbital zone needs MesoWharton. So in a real life, what I would do, in one session, MesoSculpt with MesoWharton first. So because I will apply MesoWharton, I would apply MesoWharton in the orbital area also. But, and after 1 week, MesoEye here. That's how I would do in a real life. But to show you, yes, I will inject MesoEye now. First, we will start with the MesoSculpt. That's why the patient is sitting vertically. And after that, in a horizontal position, we will proceed with the other formulas. So MesoSculpt is really very fast to inject. We call it lunchtime procedure, because instead of eating, patients go to the doctor's office to burn the fat. And it is really very, very quickly. The post-manipulation swelling, really minimal. No erythema, nothing. So the patient comes back to the office and no one sees nothing. So like nothing was made. So it's a very nice lunchtime procedure. So I need you to have more physical position. Yeah. And please sit a bit up, because you are already down. Oh, yes, okay. That's what I need. And if it is possible for you, if you can sit for a moment like that, that would be fantastic. Okay. I need the most vertical position. Okay. So, don't talk, and that's it. You can close your eyes not to see the needle. So what we will inject, I think it's the maximum, but please try. No, I need only this one. Yeah. Yeah, it's maximum. So it's okay. What we see, a very mild hypertrophy. 1 syringe is more than enough here. Mild. We can see the labic mandibular, joil fat, lateral temporal, and the medial. So here I will inject MesoEye. Here I will also inject MesoSculpt nasolabial, but the main is labic mandibular and joil fat. So let's start. 32 gauge, 6 millimeters, yeah. Okay? Hurts?
No.
Okay. I will do the same on the other side. Yeah, I will inject here more. Yeah. So here, the joil fat, again, a bit more. Yes. Actually, it's not the fat, it's the skin. It's not the fat, that's why MesoWharton here. Oh, can you please turn a bit? Yeah, like that. So, Okay, we are a bit asymmetric. Of course, different points on both face halves. Actually, this is not the 6 millimeters, this is 12. That's why a bit uncomfortable, but I can survive that. And I still have, so this is more than enough product for such face. I will inject more here, because you can see the hypertrophy here is, and the laxity here is bigger. Okay, and yes, for the cheeks to be lifted, I also inject the formula here. The last one here. That's it. So also the cheeks, the projection of the deeper facial face compartments, yep, and again, yes, and the last one. That's it. Now I will put you in a horizontal position. Yes, yeah, you can relax, I will do it. Maybe you will need to change the camera position. No, not like that. Yeah, like that. And we will proceed. We will proceed with the MesoEye. It doesn't matter from where you start. I got used to start from the lower eyelid. You can see that I'm not making pupillars. I inject very fast, but you can see, yeah, because the product is watery, so you can see how it is spreading. It looks like I'm injecting pupillars. I'm making, no. How the product is spreading, it's also individual. It depends on the blood vessels, permeability of the blood vessels, and the soft tissues of the zone. So it is always different in different patients. And here I inject deep, like I inject the Slavic faces. But I think it is good here, because the skin is not that thin. And I will try to avoid making the bruise. I will try my best, really. Okay. Malar fat pad here also. Have puffiness and swelling, so that's why we inject it also. the upper eyelid, yes, like that. Roof, we always inject more superficial than the lower eyelid, of course, because roof is thinner. Time to get up.
It's mine.
Okay, okay. Do you need it or? Okay. Yes, thank you very much. So you feel no burning, no tingling, right?
No, no.
It's comfortable, pH neutral. Yes. Okay. Okay, that's it. The temporal area and the other side. Yes. I'm changing the needle to be sharper. Okay, they also start from the lower eyelid. Look on the degradation speed already. So the full degradation period is really 3-4 days. It's really very, very short. So this puffiness post-manipulative swelling goes away.
So you use a 32 gauge?
33.
33, okay. So you're under the skin in order to relax it?
In the orbital area, it's a little bit different layers anatomy. So it is the skin. After the skin, nothing. It's the space. So after the space, the circular orbital muscle, thank you very much, yeah, and aureole ligament is fixating this muscle to the septum. So the muscle is a sphincter muscle. So when we are aging, the diameter is getting more narrow because this is the sphincter. Yeah, it goes like that. But the bone is resorbing, and the orbital diameter goes like that. It becomes wider. So that's why it's very interesting story here, because this poor muscle is like that. The orbital bone, like, yes, expands, yeah, and the skin is just by herself because it is the space between. So it is that's why it doesn't matter actually. You inject deeper or you inject more superficial, because the penetration goes to the muscle anyway. It has no way to go else. Yeah. That's why a lot of doctors in Russia use cannulas for MesoEye, and it is allowed because you will be in that space between the skin and muscle. 31 gauge, so this is like the needle cannula, the most sharpest cannula.
Our concern is that the people get very aggressive and very furious and very annoyed when you will cause bruises when you inject. One way to
Well,
avoid that is by using
well,
the
actually, you can see that it's not the bruising thin. This is the petechia thin. So, of course, my patients, you have to explain them, and they are understanding that we are in a muscle, more vessels there, so rich blood circulations. And actually, well, they are telling me, okay, we will use sunglasses for 3 days. So actually, well, this is the medical procedure. That's why, yes. But of course, we are trying to get less bruises. That's understandable. Okay, the malar. Fat pad also. And now as close as I can the lower eyelid, and we go to the upper eyelid. Yes, like that, because I cannot see. Okay. Okay.
So for the backpack, you use in the same session 2 products.
For the hypodermis, for the facial fat compartments, I used MesoSculpt. But here, I injected the malar fat pad, not with the MesoSculpt. I didn't inject it. It is because it's impossible to use 2 products in one area. So I use here MesoEye because because I need to take away the swelling. In another session, if there were only 2 products here, MesoWharton and MesoSculpt, yes, I would inject MesoSculpt into the malar fat pads and intradermal MesoWharton. Yeah.
After how long?
I will, yeah, no, it's okay, yeah, I really don't want to make bruises, that's why I need to be a bit concentrated. No, it's okay. Okay, so the intervals between the procedures, yes, I will tell you right now. And the last one. Yeah. Yes, that's it. So the intervals between the procedure are MesoSculpt and MesoEye has very short degradation period. So that's why we inject MesoEye and MesoSculpt every 7-10 days. MesoWharton and MesoXanthine, they have a different degradation period because the delivery system, molecular weight of the hyaluronic acid is different. So we can use MesoWharton and MesoXanthine every 7, 10, 14, and even 21 days. More skin atonia, more laxity, more skin thinning, intervals shorter. Less, intervals bigger. Bigger problem, intervals shorter. Less problems, intervals longer. Yeah.
And if a face was treated before, for example, by polynucleotides, how long after should I use one of these?
2 weeks more than enough, so you can. Polynucleotides, you mean plenest, something like that?
Yes, yes.
2 weeks.
Okay.
Yeah.
And the opposite, if I used
1 week.
1 week.
Yeah.
Thank you.
1 week and longer. So, but 1 week is the minimal, at least. Yes. PRP therapy, 1 week. Do you use PRP here? No, of course.
What is your normal protocol with MesoEye?
You mean monotherapy or combination therapy? How many procedures? How many procedures? So, well, in this case, I think 3 procedures will be good for her. 7-10 days. From 7 till 10, because degradation takes 3-4 days. So that's why.
Patients are happy to have even procedures every week?
Well, you know, actually, I'm the doctor and I'm the chief. And if I'm saying you are dead, then you are dead. Yeah, but yeah, of course, well, this is the treatment, this is the medicine, this is the therapy. Well, actually, yeah, I know, but it's just a mentality. Well, if the patient is motivated, he is motivated. But you can see here, no process really. So tomorrow she will look okay. So. MesoWharton. For the skin laxity, skin atonia, skin thinning, atrophic skin conditions, chrono aging, I use MesoWharton. And you can see that I am injecting deep but intradermal. And I'm also not making any papulas. I am just making classic intradermal injection shots. So, but this is the collagen, stimulation of the new collagen formation, new elastin formation, fibronectin, laminin, native growth factors of the skin, like epidermal growth factor, like the fibroblast growth factor. So, of course, I need to inject the whole zone. So, well, the skin boosters, yeah, of course it is, well, it's nice that, you know, you just have 5 shots on each side and 5 shots on another sides. Yeah, but this is the anti-aging treatment? No, this is the tuning treatment, you know, it's like when, well, you have a meeting with your ex-classmates, they haven't seen you for 15 years, and yeah, and they need, you know, just to be blinded by your beauty and forever youth. Okay, swell the face with the boosters, but that's not the anti-aging effect. The swelling goes away, the lifting also goes away. Okay, yeah. Cinderella effect, and this is the formation of the new collagen. Collagen, stages of the collagen synthesis, actually it takes a lot of time because there are 19 stages. And it takes 3-4 months. It cannot be only one treatment. It takes 3-4 months, the formation of the new collagen. So when we are providing the anti-aging treatment, the anti-aging protocol, that's why it is 3-4 procedures or even more. That's it. This is the biologic thing. It cannot be the different way. Okay, now I will be fastened. Oh, sorry. This is the most sensitive area. And the torture cannot last forever, so I will be fastened. The eye area, I would inject the same, but more superficial, because this is the intradermal product. But here we already injected the MesoEye.
The needle?
32 gauge, 4 millimeters. So I inject the submental area. I'll change the needle. So the diffusion zone is 1.5 centimeters. So that's why I inject every centimeter. Okay, so here's the small bruise. But it will be okay in several days. For the neck lifting, sternocleidomastoideus muscle projection always has to be injected. Okay. Now the forehead. Sorry. At the same time, it is impossible to use MesoEye and MesoWharton or MesoXanthine because both products, they will be just mixed with each other. Because actually the layers here are so thin, so it is impossible to combine in one session. They can be one after another. Yeah, you're welcome. So a lot of product. You can see that. Okay. Okay. Changing the needle and the other face half. Are you okay?
Yes,
So,
yes.
is it a lot of pain or just okay?
That's okay.
Okay. So the most sensitive
Yes,
zone.
no,
So
We do it
six
first.
times. 6 times. I will bite you 6 times. 1, 2, 3, 4, 5, 6, and 7. Sorry, I was lying. Yeah. Yeah. So actually, you know, the patients, they like to treat the skin, and they understand how many efforts I am making, and they can understand that they are not paying in vain, you know, like 5 injections, 1, 2, 3, 4, 5, 500 euro, get out. No, it's not like that. This is really a treatment for the skin. And actually, since we are brushing our teeth, you know, every day, minimum 2 times, so I think the skin also deserves to be treated like teeth. So if we treat the skin as an organ, of course this is different. It's not the filler, it's not the toxin. Okay, I'm trying as fast as I can. I work like a sewing machine. Yeah. Yes, and that's it. It was 1.5 milliliters, but it's a small bonus. It's usually plus 0.2, 1.7, 1.8, and now it is left, 0.8 is left. A lot of product. You can see that. Of course, the product is spreading differently in different skin types. The dehydrated skin takes more. That's definitely. Less dehydrated skin takes less the product. That's also true. Yeah. So, submental zone and the neck. Actually, I think to start, we will go and inject the neck there. Yeah, because we need to save time.
We need to show different photos.
Yeah.